So I'll start over and say good morning again. We can never have too many good mornings, especially when we talk about the PIR. The PIR report is, if you don't know, is a report that all Head Start programs across the nation are required to submit. There's a final due date at the end of August, but it takes several months to compile all of the information. So we're just going to go ahead and get started. There are many of you who can probably help coach or help lead this training because you've been doing the PIR for such a long time. I will say, if you have experience doing the PIR, one of the biggest questions people have is, how do I get access to the form? Where is it housed? What do I do with it? How do we collect information? So I would appreciate you can take some notes now, or if you have a question as we go through it, if hopefully it gets addressed and answered, then if not, of course, at the end of the session, we will have time for questions. But like I said, the PIR report stands for Program Information Report. It takes basically a big picture, a wide picture of service deliveries for children and families. But it also looks at a whole scope of things, and we'll look at some of those things as well. Can I get, let me see if I can get the screen. So we know that our PIR information is housed in our Child Plus database. And here's probably what you should know at the beginning of the year, even though we're at the end of the year. If you periodically pull your PIR snapshot report, you can clearly see what answers or what questions have been answered for yourself, for your children and your families, and what questions are still outstanding. Does anyone know how to find a PIR question in the Child Plus database? You see it all of the time, probably not even phasing it. I can't look at the chat and do the presentation. So I would appreciate if you would like to participate in this session, let's verbally do that. So because it is being recorded so that others can hear what you have to say as well. So
I don't know if you can hear me, but a lot of the questions that are beside it.
Say that again, Tarnisha.
In Child Plus, it has PIR beside it.
Thank you. It's very easy to see which questions are PIR questions because like Tarnisha just mentioned, it is listed and I think it's in a reddish color by every question that is in the Child Plus system. So when you see that question, that means at some point in time, I need to answer. I should be answering the question. So what are our objectives? Our objective is to understand what is the PIR and why it is important, understanding your role as a family service assistant and a home visitor with the PIR report. And there might be others who are on this call who will get this information later. But almost everyone has something to do with the PIR, regardless if they directly enter information in the system or not. And you will have a better idea of who has contacted, who has some involvement in collecting information with this report. We'll review a couple data samples or report samples for you to have a better understanding of how you can review your information, how supervisors can review information, and then how I review information so that at the end of the reporting, at the end of the calculations, we have 0 errors, and I have a better understanding of what some issues or concerns or where some strengths are going to come with our information. So what is the program information report? The PIR collects data on children or staff, family demographics, program characteristics, including how many physicals your children receive. Do we have mental health services? What does the mental health services look like? What type of mental health services? Of course, it captures disability numbers, the types of disability services our students are receiving, how many referrals have been collected on disabilities, and what type of category of disability has been identified for the Head Start child or for the EHS child who's on an IFSP. And of course, they want to capture family services where 99% of that comes from you. What type of referrals, what type of services are families receiving? What type of issues or concerns have families experienced throughout the year? What type of crisis situations? A lot of different questions. All that information that you see in Child Plus, the majority of it is extracted into a PIR report. As I mentioned, all of this data is then pulled together, reported by each program. And if you have a Head Start program and an early Head Start program, then those reports are separate. So if you are a family service assistant who has EHS only, then you're only going to do an EHS PIR report. If you are a family service assistant that only does Head Start, then you're going to make sure you do the Head Start PIR report. And if you happen to be specially blessed by having Head Start and EHS, then you're going to do a Head Start and an early Head Start report. So where do we think we can find a PIR report? Does anyone know? Miss Kathy.
There is a file that says home. I mean, there's a file that says reports, and I'm not looking at it right now, but because
Okay.
I can see it. But there's where you can go and find reports on what's missing in your PIRs.
Okay, so Miss Kathy's referencing where she can find the PIR report information within Child Plus, and we'll definitely look at that. But if you're also interested in seeing the hard copy version, then you can go to the ECLEC website. And all you got, or you can just go to Google and just type in Head Start PIR report. You just want to make sure that you pull the most recent one, which is 2022-2023 report. So what does the PIR include? So now we have a better idea by looking at this screen, 6 of the predominant areas, one starting with ERSI. Based on your information, you clearly put in Child Plus, right? The date of birth for our kids, are the income for our families, how do our families qualify, whether they're repeaters, what year in the program they are, their transition status, are they drops or no-shows, pregnant moms, attendance. So that captures most of what ERSI looks at in the PIR. But then I can look specifically at age or income. And as you know, it's going to break it down even more. It's going to want to know how your family's qualified, right? Are they homeless? Are they over income? Are they between 101 and 103? and 30% of the federal poverty guidelines. So ERSI captures a whole lot. And the PIR, even though it doesn't start here, because it starts with program information, which is one of the categories, meaning they want to know who our board members are, who are our policy council reps, and their contact information for all of our information. And of course, grant details. Who who are specific people who have specific responsibility within the agency and who provide oversight, the locations and the addresses of all of our centers, including our partners. When we do this, this report is for all children and families. It's not just Hopkins Lock. It's not just Central Plaza. It includes our Lorraine City School, children and families. It includes our Little Lighthouse children and families, Horizon, Home Base, all of our program options, and all of our services. It also looks at education services, our hours, excuse me, our hours, our partners, if we have dual language learning classrooms, what type of assessments do we do, how often we do assessments, what type of screenings do we provide for our children, and how often do we do screenings, our observation tools, of course, if our curriculum, is it research, are our assessment tools and screenings, are they research-based tools, or are they specific to programs, or did someone create an assessment tool? And this also includes mental health services, as I mentioned before. When we look at overall health and dental services, and this question is, you'll see a sample of a report later on, but all of these areas are equally weighed. There's nothing that's more important or less important from what I know. Every question has to be answered, and numbers must add up. So they're going to look at insurance and what type of treatment and services have our children received during the course of the school year. They're going to look at all of those screenings, those heights and weights and hearing and vision screenings that you do for our students, but also who didn't get screened, or what, looking at our numbers of, if I've got 100 kids, but I've only got 80% completion rate, they're going to want us to be specific. So when there's opportunities for comments on why something doesn't get completed, or comments that we can provide explaining why our service numbers or our outcomes are below 100%, then that's our opportunity to explain things. But it's also a way for us to identify trends, and then they look at trend levels in different ways. So they want to look at dentals, prenatal health, immunizations for pregnant moms, pre and postnatal care and services. So there's those health and dental questions that you guys see every single day. The expectation is, once you submit your PIR, you're hoping that you've completed services, meaning you've delivered the service, you've provided the service, the parents received the service. And in the end, when I give you the end date, that's the expectation. But as always, especially as things happen throughout the summer, if you're still working with the family, if a family still provides you information, my expectation is that you will go back into the system and make those edits as necessary. It's not for normally a large number of families, but it tends to happen, especially for those students who are repeaters or returning back in the fall. They're still working on things that maybe clearly you have worked with them on, and we want to be able to capture that. And there are many of you who do that without reminding, but the reminder is there, is Once again, regardless if I give you a due date, if you are there and it's the end of July and a family has said, well, I completed, Johnny's, I've updated his immunization record, or I've got a updated physical, or, you provided me a referral to, Guidestone, or I'm going back to school and I registered. Those still fall within the program year. And so maybe I should say this: services, information that's documented within the PIR is anything from the time period of August 1st to July 31st. Okay. So human resources, we're looking at staffing, credentials, salaries. We're looking at, the number of highly qualified staff in all positions. We're looking at the expertise or the qualifications or experience of people who are identified as managers or specialists or coaches, and whatever else they want to identify. Of course, they look at staff turnover, and also looking to see, do we meet the national, Head Start guidelines for when it comes to, the number of teachers having bachelor's degree or higher. As we mentioned, family services, they're going to look to see not just how many homeless families that you have, but there's always a question at the end of, well, I say at the end, near the end of the report, that will always ask, how many of your identified homeless families acquired housing? Well, you and I both should know that not every family who's identified as being homeless is looking for housing. So I'm not expecting, if we've got 25 homeless families identified, as meeting the McKinney-Vento definition, expecting all 25 of them to have acquired new housing or different housing. If that's the case, then great. But we realize and should recognize that not all of our homeless families are in that situation or where they might need to even look for different housing. Let me take a quick breath. Are there any questions about any of what we just discussed or what we've discussed prior? Anybody? Okay. Oh, I saw a hand, Tina. I can only see 5 people. So I see Tarnisha, Miss Kathy, Tina, and Diana Rife. That's it. I can't see anyone else.
I just had a question if anybody could answer this for me. So I noticed in the PIR, if the family is identified as homeless at the time of enrollment and we're entering the stuff in Child Plus, then it gives you the option at the end on the PIR to say, yes, they received housing like you said or not. But so I understand that part, but my question is, if at the time of enrollment they were not homeless, when I go into but during the school year, they became homeless. When I go into the PIR report, if it was a no at enrollment, it is shaded gray and doesn't let you change that answer. I can't figure out how to change the answer. So that's my question. So if they're identified at enrollment, it lets you answer that question in the PIR. If they had a home at time of enrollment, but during the year became homeless, it's what I see is it's gray and it doesn't let me change it to, or is the question at enrollment?
The question, I don't think it says at enrollment, but because you determine eligibility at enrollment and homeless is an eligibility factor, it's going to stay with them. Now, I have overriding capability. So if you or anyone else has that, because I would really like to capture all of our homeless families. And for a couple different reasons, I have a homeless grant. I'm getting ready to purchase some items for those students. So I am pulling from PIR. I'm not PIR, but yeah, PIR or for Child Plus to see who's identified. So if you know that your family is not represented in that number, just shoot me an email, and what I can do is override it. I'm not quite sure if I can change it, because then it just totally changes the flow of the numbers, but I can at least capture that and put it in the report and use it for other things. Thank you, Tina. Anybody else?
Yeah, I have a question. Okay, so I have a family that I just referred to, that Good Nights, they do the beds,
Mhm.
and I wasn't sure how to document that in PIR that I did that. And I put it in like the contact, the family services. Is that where I'm putting that? That what I did, who I called, and that what I, the steps I told mom to do and all of that. I'm putting that in the family services thing in Child Plus. Is there a different thing that I should be doing as well?
I don't think so. You may go to where it goes for family services. Look at that tab where it lists. So it might be in children's services, but there's a tab within within the PIR that just talks about all of these additional services. But it may not, it's not meant to capture everything, Miss Kathy.
Okay, that's
And
kind of what
many
I was
times
thinking.
there's not even a other category. Sometimes the
Okay.
Office of Head Start is just looking at certain titled things, if there's a general category, which I don't think there is one, then you can do that. But I don't think it helps them in understanding what types of services.
Okay, yeah, 'cause
So go ahead.
oh, I'm sorry. Yeah, my superpower is doing things and then forgetting to document that I did them. So, or not, or just putting them in the wrong place. So that's why I was kind of figuring that. If nothing else, I put it in family services as a contact and what I did,
Absolutely.
and then okay, cool. I just want to make sure that
Absolutely.
that's getting counted the way it should be. Okay, thank you.
You're welcome. And so that's a good point. It's not gonna capture, it's not necessarily requesting or requiring everything you do for your families. These are the questions that they decide on, and those are the questions we, have to answer. But there's nothing about adding additional information. So before we move on, in ERSI, you will see that there's a new attendance question. They've been wanting to ask this to drill down more on attendance for a few years, but COVID hit, and then that didn't make sense for them to focus on attendance. But attendance questions look a little bit different in the PIR this year.
Stephanie, I had a question.
Sure.
Based on what I couldn't see who was asking the question about the homeless, can we just go and click on the child's file and then right next to attendance, click the PIR and just change it from homeless family to from a yes to a no or no to a yes and just,
I think that's what Tina was saying, that
Mhm.
it's graded out. Some things are graded out by default. Once you answer it, you are not necessarily
because
able to change it.
because I am in Child Plus right now and I click on the child's name and go to the PIR, and if it's where it says homeless family, if I click no, it says acquire housing during the program year, then that's graded. But I can change it from no to yes on the homeless family.
Well, go ahead and change it.
So
I mean, if it allows you to do it,
yeah, like it allows me to do it in like all of them. The only
And
thing that
just
doesn't
make
allow me
sure
to change is if
the
they
key,
acquire a home or not during the year.
gotcha. And the key is making a case note on that,
Mhm.
that you have changed. There's one, it's one thing if a question is saying, how was a family how did we identify eligibility for a family,
Mhm.
right?
Mhm.
So at the beginning of enrollment, the family, they work and they're eligible or they're over income, whatever their status is. But that doesn't mean that they won't become homeless, throughout the program year. So we want to be able to capture that, no different than, if someone, purchased a new home or they moved. If the system allows you to make the necessary changes, then do that and
And just
always do a case note.
case no reflecting the change that was made and why.
Absolutely.
All right, sounds
Especially when it
perfect.
comes to someone's housing
Okay, sounds perfect.
status. Mhm. Any more questions before we move on? Thank you, ladies. So where does the PIR data go? Well, first of all, we're looking at our own local information, your work, our work. We want to look at that. The system will create reports, and I'll show you that in a few minutes of what that information looks like. But as supervisors, as a program specialist, as a FSA or home visitor, we've made the system so you should be able to understand your own numbers. It's a reflection of the services that your children and families are reviewing. You should take the time for some self-reflection to say, what does this story tell me? What is this information about my families that I'm servicing? What is this information about our centers, children and families? What is it saying? Is it going to say everything? No. Is it going to tell everything that you did? No. Is it going to count every home visit or every phone call you made? No, it did not. That's that might be part 2 of the story. But whatever the Office of Head Start is looking at, these are the questions they want to know. It doesn't mean all the other stuff isn't required. It doesn't mean that all the other stuff isn't important, but the questions you see in the system, or if you're looking at the hard copy form, that's what they want to focus on. And then what they'll do is they'll pull all of the information with 3 other different levels. They'll pull all reports from Ohio. And guess what? You all can pull those same reports. Once the data is aggregated, anybody can pull these reports. You can pull it for any program, you can pull it for any state, you can pull it for any region. But then there will be state level data, and it will compare Lorraine County Community Actions data to all of the other programs in and around us. Then it will pull all of the data in their region 5, and we'll be able to look at their numbers, and they'll be able to look at our numbers. And sometimes there's email exchange or communication exchange to say, how are your numbers so low? But the more you look at information and the more you get to understand or learn about other communities, then we're able to have those conversations on why maybe dental referrals or dental outcomes are so much lower in certain areas, or why getting physicals and shots are easier in other areas, or why housing is an issue in certain areas. The numbers help us have discussion. Yes, it tells a story, but we're able to have discussions about what's happening. And then there's the federal level data where they will take all of these reports from all across the nation, and then they will generate baseline scoring, where then there is conversations. They don't tell us, but based on what they find after they compare all of these programs, once the reports are finally submitted, Then there is a conference call with the Office of Head Start, and normally Shauna and myself to discuss the PIR. Sometimes there's very specific questions they'll have, and then other times they'll just want us to talk. They'll say, tell us what your numbers told you. What are you doing differently? So it is my hope that you may not realize it, but as we always try to be more transparent in what we're doing, that if there is a new task, a new assignment, or if there is a new plan, if it has anything to do with the PIR, we want to say it's due to the PIR. We're going to look at homelessness different. Due to the PIR, we're going to look at fatherhood involvement differently. Due to PIR, we might have to look at program options differently. Sometimes we make changes clearly that have nothing to do with the PIR, and many times we do make changes or revisions because of the PIR data as well. There are times, and it hasn't been in recent years, where we've had to do action plans because they may do a comparison to the federal levels and say, you guys are at 82% and we're expecting programs to be at 85% for whatever that target area is. So maybe it's, dentals has always been a popular one. So that number may change. If it changes, they'll let us know. We haven't had to do a recent action plan in recent years, but you never know. It's up to them to decide if they feel that programs need to work a little bit different to get their numbers higher. Any questions about state, region, or federal level data? So who am I counting in the PIR? This is a very easy answer. Your current students and families, meaning who are you servicing today? And 2, any students who have dropped. So Child Plus has built in so that if you have dropped a student during the year, it should automatically be calculated in your numbers. The only students who are not counted in the PIR or families are those who are no-shows. Doesn't mean you don't have a physical on them. Doesn't mean you don't have a dental on them. It doesn't mean that you haven't even you may have done a home visit on them before school even started. But for the purpose of the PIR and the Office of Head Start, no-shows are not counted. Current students and families and drop students and families. So there's also a question you'll see in the PIR and in Child Plus at enrollment and end enrollment. And please forgive me if you hear background noises. I've tried to let the dog know and the retired husband know that I'm doing a Zoom, but noises still happen. He's not laughing, sorry. So at enrollment and end of enrollment, I mean, those time frames can be, we just had a student just start. So guess what? It's kind of hard if you just had someone start 2 weeks ago. So what am I doing at enrollment and enrollment? Well, that time period may be a very short window for that student and that family. But then the majority of families start right in the fall, and the majority of them end here in the spring. So you have a larger window of service delivery time. So you need to make sure that all of your questions, especially if they say at enrollment and end of the enrollment, are answered. So let's look at the numbers. One of my favorite reports. And if you've heard me talk a while, You know, I love Child Plus reports. So this is report 9900. And we're looking at the numbers. This is the most simplified PIR report because all it's doing basically is doing a count. It is reporting what you've entered in the system. So I want everybody to take a minute or two, and we're going to look at our math. And I love math. And I want you to write down what you see. Does it look good? Do the numbers add up? Do they make sense? Because we're going to have a conversation. And just know, if I put it on here, I put it on here for a reason. I don't have any Jeopardy music. But I want you, let's look at the total number of families. Of these, the individual indicated that they had 48 families, right? A, of these, there are 2-parent families is 7. B, of these, the number of single parent families is 38. Based on those 3 rows, what does it tell you?
That is
It doesn't add up.
It
Doesn't
doesn't
It doesn't add
add
up.
Okay.
Oh, it's 3 missing, yeah.
All by 3.
Okay, all right, we are off. And guess what? That's just the beginning. Well, maybe it's not the beginning. This is just one number, but one number will create 3 different errors. All right, so we got that one. So let's move down to 34. So of these total number of families, which is what? 48, right?
Yes, 48.
How many of them in A are parents? So we have that number, which is 35, right? Is that what it is? 35. And of these, the numbers with the family only. So this is, I'm sorry. Okay. Of these, the number of families with the mother only, and of these, the number of families with the father only. Does that tell you, does that say anything to you? Is that okay? Is that all right with those numbers right there?
It could be okay because it could be another family member or grandparents
Right?
raising the
Meaning you've
kids.
got to look at that whole category. Sometimes it will make you stop and the numbers might add up to it, but let's keep going. You're right, Miss Dana. You've got grandparents, you've got other relatives, you've got other foster parents. So let's do the math. What is it telling us? Anybody?
So these 2 numbers added to 6.
Maybe that some people fit into more than one category,
Interesting.
you know, because you might have a grandmother and a mother there, or like 2 different kinship caregivers who aren't necessarily biological mother or an adopted mother, which I actually have one of those families right now. But
Interesting take on it. I appreciate that, Miss Kathy. So we're not even explaining it away. We're just doing math. We're not even trying to understand family dynamics. We're just trying to do the math. Because if the math doesn't add up, you've got to make sure you go back and say, why isn't my 48 families adding up in the description of my number 34 families. You following
There's
me?
only 37 families accounted for.
Exactly. So we've already got, so if we do a recap in 33, I'm telling you, I've got 48 families, right? But like you all mentioned, 3 are not accounted for. So I've got to correct those. Working with 48 families. And A, B, C, D, and E add up to what? I know someone just said it, I'm not sure who it was. What does A, go ahead.
She said 37.
So where are we off at? How many are we off?
11.
We are off 11 families. So that's just a quick sample of a low number that can be hard. It takes a few minutes where we have to look at it. So can you imagine if you're looking at thousands of numbers, 1100, 957, and I'm sitting there like, where are we at? So if we make sure that it starts with our data entry, and the more your numbers add up and make sense, the more it's going to make sense down the road, because in the end, it has to make sense. The errors have to be corrected. So when you're able to pull your own information and you're reviewing the numbers and they add up, then we'll be good. Any
Ms. Drew,
questions on this one?
Ms. Drew, we
Yes.
have to also remember that it's families, not children.
There you go.
I don't know,
Yep.
can you hear me?
Yes, I can hear you. Great. And remember, these should be populated by Child Plus. So no one's asking you to go in there and, hand count all of your families and where, pull your forms and look to see. But you have to realize you've got to go back and look at something. And we're going to show you how you get there, because that means questions have not been answered. That's what this report tells me, that questions have not been answered throughout, throughout your individual family's, system of questions. That's all it's telling me. Okay, let's see. All right. Can you see this? Is this too small? Yeah, I don't know if you guys can enlarge it. You might need to change your own view. Can you see that? Did that enlarge for you? Okay, see a little better? Okay. So, I know now. What we're looking at is the last 2 categories. So we're just gonna start with, it looks like it's insurance for children, right? I know part of it is off the screen. So we're looking at health insurance for screening. So I want you to look at those 2 short columns, look at those numbers, and tell me what it's telling you.
That insurance for the children is went down by the end of the month.
So Ms. Tarnisha, how likely do you think it is out of 55 children who had insurance at the beginning of the year that they didn't have insurance at the end of the year?
Likely,
Say that again.
you're asking how likely would it be?
How
that they
likely
lost
do
her-
you think that is?
Not too likely.
Not too likely. Exactly. So the numbers immediately should be a caution flag, a yellow flag, a red flag to say, So if it comes to me this way, I'm looking at to say, but I can't filter out 11 because I'm looking at everybody. That's why it has to start with the individual. So if your numbers look like that when you pull, a preliminary report, once again, more than likely, the odds, my experience tells me that I just didn't answer or update at the end of the enrollment year's numbers. The numbers just match exact 55, 44, 55, 44. And now I have all these kids who have no insurance. No, that's just the math playing tricks on me. If you have 16 kids in your caseload who don't have insurance, is it truly that they don't have insurance? Or is it we don't have that information from the parents? Did the parent actually tell you that they don't have insurance? Or is it, I don't have insurance card, so I'm just assuming that they don't have insurance? This is red flag all the way around it. Not in this community, maybe in someone else's community. But if we had that many, if you do the math and do the percentage, oh, we have 15 out of 55 kids who don't have insurance. That's significant. And that's how we have to look at the numbers. Do they make sense? Is there someone or a couple that might end up without insurance? I hope not. But if that's the case, maybe it's because someone got married and they lost, or in COBRA insurance was, too expensive, or they just don't qualify. Something changed in their family dynamic for why that child is no longer eligible for health insurance. Any questions? Go ahead.
Stephanie, would you expect this year with the SNAP benefits and everything else changing, that might change things, like with the end of the COVID acceptance? Could that possibly play a fact in this coming year?
Not health insurance.
Because I thought they were even changing that. I thought they were changing like the if you were eligible, they didn't have to reapply, and now you may not be eligible anymore.
It's a possibility, but our numbers in the state of Ohio should never be in double digits for kids not having health insurance.
Eligible. Okay.
Ms. Stephanie,
Mm-hmm.
I did talk to somebody at ODJFS, and a lot of the recertifications for health insurance will start August 1st.
August 1st.
Yep, so we should be okay as far as this report.
That is good to know. But yeah, there will be differences. There's going to be all kinds of differences in the next year, as we know, for all different levels of services. But it still should not be double digits for this year, like Miss Dana said. Okay, let's move on to, what do we see for the next one for early Head Start for insurance? Is there anything? What do those numbers tell you? And it may mean different things because you may not know, but any questions, thoughts on those numbers? Okay, timer goes off. The point is, you may not know how many EHS pregnant women have been serviced, but for our EHS home visitors, all that's telling me is that I have, one woman with insurance. But once again, if I serviced a total of 4 or 5 pregnant women this past year, I'm still going to be concerned. One, what? Are they not eligible? What type of care are they receiving if they don't have insurance? And these are our pregnant moms. So it's not just about the numbers. It's the question of, did they not qualify? Did they not apply? Or they're waiting for a husband, or a boyfriend, or what else is happening? Because I can't go get a prescription without paying $20, let alone go to a hospital. How are they paying and receiving coverage? Those are the questions I would be asking, or at least thinking about. And of course, this is a big one. We're looking at healthcare, accessible healthcare. So what does it mean when we say accessible healthcare? accessible dental care for our children.
It should all be accessible because we have providers.
Thank you, Mrs. Watkins. Is our community an accessible healthcare community? Would you think?
Yeah,
We definitely are. This is one of those things, there are plenty of communities in Ohio that are not. There's one dental, meaning one pediatric dentist, or people got to travel, 50 miles to go to the the local, pediatrician. That is not the case in our community. So when we look at these numbers, if 47 children was our number of children that happened to be at enrollment, then I'm okay with that. But once again, it's now the end of the year and we're down to 34. So I'm wondering what happened to healthcare for these 13, Well, and it's not about healthcare. I'm sorry, that's not insurance. It's about how do we go from 47 to 34? How are they not accessible? If you identified a medical and a dental home at the time of enrollment, then you're telling me now all of a sudden they don't have a medical home or a dental home for 13 less kids. That's how I look at that number. That's how I look at that information. Okay. So if we look at the accessible healthcare pregnant women, are my EHS ladies on this call? I'm going to specifically ask them. My home visitors, I want you to look at that number. We have 0 at enrollment and 0 at the end of the year. What's that saying to you? I'm hoping somebody's on because I can't see them. Is anyone?
They are on.
They are? Okay, thank you, Maria. I mean, is it okay to have 0 and 0?
Speaking, but she's muted. Teresa, there you go.
I will answer that. Maybe it's a first-time pregnant mom that needs help getting health insurance or qualifies for the assistance for health insurance. And at the beginning of enrollment, it's, she doesn't have insurance, and then we refer her and help her get insurance through the Department of Job and Family Service. And so that, can you reject insurance? No. But I say that if we refer them and they don't do nothing about it, we can't go make an appointment or go to the appointment for them. I don't know.
No, I'm not asking you to do that. But what I'm asking you is to make sure that you understand the reasons why. So your explanation of what you just said, if that's the case, then wonderful. Because if I have a question, or if Judy says, we have 3 pregnant women this year and none of them had insurance, talk to me about that. And if your explanation was exactly what you just mentioned, Ms. Pagan, then that's great, because there is a backstory, there's an understanding. And we can show, as you mentioned, that there were referrals that were made, or document in your home visits conversations about the importance of having health benefits to make sure that they're getting the services they need pre and post delivery. The point that I'm trying to make is making sure that the numbers make sense to you, that they add up, and that if the numbers are not meant to be where we think they should be, and if you have 10 kids who don't have insurance, then I could easily say, why do we have 10 kids in the state of Ohio who don't have insurance? And you could explain it away. Great. If it's not explained away, then that's not so great. The point is, when we see a gap in care, when we see a gap in service, we're here to try to fill those gaps. That's all. Trying to make sense of it. And sometimes that may be early on in the year, maybe at the end of the year, and it may be year 2, and it may be year 3. But as long as the numbers make sense to you and you can help explain some situations, then we're good. Then you're good. Most importantly, we're hoping that the family is better than good. Okay? Okay. Sorry. So just once again, just trying to get you a deeper dive into how numbers look, and we compensate based on the information, you best can provide, but when numbers don't make sense, they just don't make sense. So if we look at the number of children who are up to date on a schedule of age appropriate preventative and primary health care, this is where it really gets tricky. It would be great if you had 50 kids and all 50 kids were up to date. The red flag comes into if I've got 50 kids and they're all up to date at the beginning of the year and they're all up to date at the end of the year. That's like 99.9% never happens. At enrollment, it's based on whatever you put into the system. So I'm looking at this report, and at enrollment, there was only 1. Now you might say, oh, that number is too low. So this is where we've changed it up in our processing and looking at the numbers. This individual may truly have had only 1 child who was up to date at the time they enrolled in school. Nothing wrong with that. The key is hoping that at the end of the program year, there has been progress, meaning that this child is is up to date, or we have more children who are up to date at the end of the year. Because what this isn't telling you is how many kids were initially enrolled. So remember, I know it's EHS, but let's stick with 50. If I had a total of 50 kids who enrolled this year, I may have only 1 kid who was up to date at the beginning of the year, correct? What I'm hoping, which will look much better, is that we would have more than 0 in that column. So regardless of where you start at enrollment, that number can be any number. What we're looking at is the progress your families made at the end of the year. That's what they're hoping to see, is that at the end of the program here, those numbers are either the same or have increased. And if they have decreased, many times they want to know the reasons why. Are there any questions about these questions? I'll give you a chance to read through, the page. There's not a whole bunch of numbers here, but you can see the types of questions. You see them every day. They're in your Child Plus. One of the things I get a lot of conversation about is question number 8, the types of services. Many times people feel like there are other health conditions that their children or that their students, that their families are experiencing with their kids, but it's not reflective here. And this is what I've said, that if it's not listed here, then the Office of Head Start just won't know about it. These are the ones they want to know and don't screenshot this because this is not even the current PIR, so there may have been a change. But my point is, this is it. So if you didn't have a child who didn't have or had some other condition or situation, then it's clearly not being reported to them. Your body mass index, BMIs, that information should automatically be, you know, calculated by what you've entered in Child Plus. Okay. Any questions before we go on reports? Okay. So when you look at some of your PIR reports that are available to you, I'm still on report 9900. You see how it looks. You see how you can examine and do a review and highlight and make notes on your report for you. But on the left, you can see how the information is calculated. This is how it's defaulted in the system for the report to be pulled. So technically, you should not have to mess with any of these. However, then you will just have one massive report that just details you the answer. What you would want to do is, if you want to specifically pull a report for questions that have not been answered, if you go under, you see where it says answers, show PIR fields with the following answers. Does everyone see that? Yes? No? Maybe a head nod would help. Thank you. Thumbs up. Thank you. So you would just want to click on that, and then you can pull, it's going to say one of three things. It's going to say all, it's going to say yes, and it's going to say no. The system is set at, oh goodness gracious, what is the system default? The system is set where you are required to answer the question, yes or no. So if you pull up a report that says yes, okay, that's just telling you all of the people that you've answered the questions for. If you pull up a report that says no, that means those fields have to be answered. And if you pull up a report that says all, then you're going to have a combination of yes and no. So that's how you can pull up a report that's going to be specific for you. I am not 100% sure. I know in the past that you used to be able to, when you pull that report, it will be in blue, and you used to be able to just click right on that child and it would open up so that you can answer. I'm not sure if it still allows you to do that or not. But you can try that. If not, then you would have to click on the name of the child to go back into the child's file to answer it. Does anyone know? Has anyone checked that? Or probably not, but that has always been an easier way to go in and answer the questions, is just clicking on the blue link that says no. So that's the PIR answers and how to pull your report. There's the system that also tells you how questions are calculated, and which questions are PIR questions in all of the service areas. That's just more of an FYI. And then there's a way, with the box right in the middle, on the bottom of the screen, where we can just pull up numbers, and it's just telling me how many answers have not been answered or how many are blank. I'm sorry, that's it, blank. If it is blank and it's in blue, that means you have not answered. You have to answer yes or no to complete the process. So that's looking at reporting. Any questions on this or how to pull up your own reports? Okay. So earlier I mentioned reports. So this gives you a view of all the different types of reports then the PIR oh goodness, shows us. Performance indicators, and this is one of the top reports that the Office of Head Start looks at. And remember when I told you whether or not we do an action plan, that's what they're really looking at. They're looking at performance indicators, how well, and that's what they're doing, comparing us to all other Head Start programs, state level, regional level, and the federal level or national level. And then they create a performance level indicator report. It can create summaries of just ERC reports or health reports, all the different areas we've talked about. It can generate specific reports. So if it is, if I'm working with Becky on health and nutrition stuff, I'll pull these reports for her and say, here you go, Becky. This is what the reporting is looking like. You might want to take a review, before I submit it, or most of the time that review is just, discussion between her and I of what else can we do? What are these numbers looking like? We're able to compare to prior years as well and be able to say, ooh, our numbers have dipped or our numbers continue to increase. And why is that the case? Sometimes we don't have an exact answer, and sometimes it makes sense why things may have a better outcome. Our family information report, those are those family services that we were talking about. But remember, like I said, the family services that are reported here doesn't necessarily mean it equates to all of the other services and referrals that you have provided. You can see all of the other areas of education, administration, but these are the reports that the PIR will pull so that our regional specialists can look at them and that we can look at them as well. Those are sample reports. So let's go to due dates. We, as you probably may or may not have guessed, we're working on coming up with the summer layoff plan as of right now, because there's been changes in the calendars. If you have a Head Start report, that will be the preliminary due date is June 9th. EHS due date is June 30th. And once again, you can make edits as needed, after these deadlines, because I'll be working on them throughout July and August to finalize our numbers and reports. Questions? Did I put everyone to sleep? You guys look like you're here. PIR is not exciting, but if you have to look at numbers, it could be worse. It's not bad. It tells a lot of great information and interesting information. And then there's a whole other, pages of other questions that you don't answer, but it will talk to us about volunteers and volunteer hours and, backgrounds of people and, all the questions that clearly we didn't go through, but that other program or service areas are responsible for completing as well. So that information goes to our professional development specialist who has to, report on,